Hello, everybody. Good to see you all again. And I hope everybody's been having a good day and good month so far. Can you believe it? January is finished of 2022. We're now hitting the second month already. So yeah, this world is moving at a rapid rate. Okay, so this week, because this is February and traditional Valentine's month, which goes together with the heart, because of love, etc., etc., etc. I thought I'd cover the cardiovascular system, that little ticker box in our chest that keeps us all going and alive and kicking, because if it wasn't there, we would be in serious trouble. I'm going to share my screen and get on with my presentation. And shrink everybody down. All right, so tonight and over the next probably 2 weeks or so, because this is quite a long presentation, I'm covering the heart and the circulatory system and why and how do we care for them? Because to put it bluntly, if your heart is not there, you are not there. And if the circulatory system is not working properly, parts of you are not there if the whole of you is not there. So the heart and the circulation are very, very important parts of our system. So your heart, as probably everybody knows, sits in your chest a little bit to the left, and it's enclosed by a nice big cage called the ribs, and that protects the heart. But the heart is there. It starts beating from probably about a couple of days after, or maybe a week or so after conception, and keeps going until the day that we check out. Your heart is probably the hardest working muscle in the entire body. Your heart is a pump, is a muscular organ, roughly about the size of your fist and located slightly left of the center of your chest. There are a few people in this world whose internal organs, interestingly enough, are reversed. So their heart is actually on the right. But the vast majority of people, their heart is slightly off to the left. Together, your heart and blood vessels make up your cardiovascular system, which circulates blood and oxygen around your body. Every time your heart beats, the blood circulates from the heart right the way around every single part of your body in a pulse beat. Think about that for a minute or two. Now, your heart is divided into 4 chambers. Yes, this is slightly technical, but please don't get hung up on all the technical names and all the rest of it. This is just more for background to put it into a little bit more perspective about exactly what your heart does and how it works. These chambers include 2 on the right, called the right atrium and the right ventricle, and 2 on the left, called the left atrium and left ventricle. Quite simple terms over there. The division protects the oxygen-rich blood from mixing with oxygen-poor blood. Your heart has 4 valves that keep your blood moving in the correct direction by opening only one way and only when they need to. It's an incredibly technical, involved piece of machinery. And you can just imagine how well it was designed. In the beginning of a pumping cycle, oxygen-poor blood returns to the heart after circulating through your body. The oxygen-poor blood fills the right atrium and then flows to the right ventricle, where it is pumped to the lungs through the pulmonary arteries. As I said, don't worry about the big fancy words. Medical people like these words. It makes them sound clever. The lungs refresh the blood with a new supply of oxygen, which comes from the air that you breathe in. As I said, a very, very intricate little system. The now oxygen-rich blood returns from the lungs and enters the left atrium. The oxygen-rich blood then flows from the left atrium to the left ventricle, and this blood is then pumped through the main artery that supplies blood to the body, called the aorta, to supply the tissues throughout your body with oxygen. And we're talking every tiny little tissue in the body, be it the brain, be it the big veins in your legs, or be it the tiny, tiny little ones in the tips of your fingers, and even in the base of your lungs as well. Your heart is nourished by blood too. Oxygen-rich blood is delivered by coronary arteries that extend over the surface of your heart. A beating heart contracts and relaxes. Contraction is called systole, and relaxation is called diastole. During systole or contraction, your ventricles contract, forcing blood into the vessels going to your lungs and body. So it's a squeeze. Your ventricles then relax during the diastole and are filled with blood coming from the upper chambers, the left and right atria. Then the cycle starts all over again. So think of this whole thing like a sponge. You put a sponge in water and you squeeze it. It becomes very small. Now you release it and that sucks up all the water around it. And then you take it out the water, you squeeze it again and all the water now leaves that sponge. Your heart is working along a similar system. This cycle is driven by your heart's electrical wiring called the conduction system. Yes, we do have an electrical system as well. Electrical impulses begin high in the right atrium in the sinus mode and travel through specialized pathways to the ventricles, delivering the signal for the heart to pump. The conduction system keeps your heart beating in a coordinated and normal rhythm, which in turn keeps blood circulating. Should it stop, we're in trouble. This results in a continuous exchange of oxygen-rich blood with oxygen-poor blood that is necessary to keep you alive. This carries on 24/7 for as long as you are alive. Interestingly enough, even if you are kept alive on a machine in hospital, the same thing is still happening. Your heart is still pumping. So the importance of the heart. The heart pumps blood through closed vessels to every tissue within the body. Now think about it. It's got to go from here in the chest, right down. Well, first it should say up to the brain, which doesn't take a lot, but then also right the way down to your toes and to the soles of your feet. Now, dependent on how tall you are, think of the amount of force that is necessary to get this blood throughout your body in a pulse beat. You want to know what a pulse beat is? Touch your wrist and you can feel your heart beating. The blood itself then delivers nutrients and oxygen to every cell in the body. And as we know, there are over 73 trillion cells. Without blood, the cells and tissues would not function at their total capacity and would begin to malfunction and die. And this is what happens in diabetics, for instance, and other illnesses and issues where the little blood vessels in the tips of your fingers and your toes, etc. So people who suffer from frostbite, for instance, those areas die off because they're not getting blood and oxygen-rich blood that it needs. Essentially, the heart is the pump that gets nutrition to every cell in our body through the medium of blood. If your pump isn't working, then the blood cannot flow and our body cannot live. So, common diseases of the cardiovascular system. We all know of heart attacks and strokes and things like that, but there are actually a couple more. Cardiovascular diseases can be severe and potentially life-threatening. Understanding the conditions that can affect the cardiovascular system may help people seek appropriate and timely medical care or medical advice. Cardiovascular diseases include things like heart attacks, stroke, heart failure, which is different to a heart attack, and a thing called arrhythmia. Circulatory disease includes high blood pressure, arteriosclerosis, coronary artery disease, or CAD, aortic aneurysms, and peripheral artery disease. So, a heart attack. I don't know if you know of anybody who's had a heart attack. Quite often we think of a heart attack as being fatal, but not always. There are, in fact, quite a few people who have had a heart attack. They feel funny, they feel strange, and only when they connect the ECG nodes and things onto their chests do they find out that they, in fact, had a heart attack. Sometimes people have heart attacks on a theatre table when you're undergoing surgery because the system is overloaded with the shock of whatever surgery is happening. So a heart attack happens when a part of the heart muscle does not receive enough blood. If you've ever experienced a cramp in your calf, that is what happens to your heart when you have a heart attack. Now, this can occur due to a blockage, a tear in an artery around the heart, or if the heart requires more oxygen than is available. Symptoms of a heart attack include chest pain or discomfort, and sometimes people will say, oh, I feel like I've got heartburn or indigestion. A feeling of lightheadedness, pain or discomfort in the jaw, the neck, or the back. Pain or discomfort in one or both arms or shoulders, usually in the left arm, but can be both arms. A shortness of breath. Three of the main risk factors of a heart attack are high blood cholesterol, high blood pressure, and smoking. Smoking is a nasty, nasty thing and can cause all sorts of different problems. Most people associate smoking with lung cancer, but the sad truth is that smoking causes all sorts of other issues as well. So stroke, and there are three different main types of stroke. There are a couple of more, but the three main ones are hemorrhagic, ischemic, or arteriosclerosis. A stroke is a medical condition in which the blood supply to a part of the brain becomes cut off. And I do know that we have some people that we know in this group and in this team who have had strokes, but through the wonder of proper nutrition, have overcome those issues. This lack of blood supply triggers the death of brain cells. Now, there are two main types of stroke. Ischemic stroke occurs as a result of a blood clot blocking blood flow to the brain. And this we're seeing quite commonly now post-COVID. So we know that COVID causes a lot of clotting in some people, and we are seeing an increase in the number of strokes in people as a result. And a hemorrhagic stroke occurs as a result of a bleed in or around the brain. So it usually is a burst blood vessel in or around the brain. And when people are extremely stressed and you see them go, or they're very, very angry, they go red in the face, we say, oh, be careful, they're going to have a stroke. That is true, in fact, because what happens is their blood pressure is now increased. And quite often, just like a water pipe that can't handle pressure, you will have a burst vessel, which then leads to a stroke in that particular area. Some significant risk factors of a stroke include high blood pressure, diabetes, heart disease. Smoking, again, personal or a family history of stroke, which just means that your risk is slightly elevated, and older age. Scarily enough and sadly enough, we are seeing younger people having strokes these days. Fortunately, it's not that common, but I do know of quite a few people, and I've had quite a few patients who are young and have had strokes, quite often brought on by various other issues, but there's still, the end result is they still end up with a stroke at a very young age. Whereas we tend to assume that an older person is more liable or more at risk of developing a stroke. So how do you spot a stroke? There's a couple of signs, and maybe we need to give Jenny a chance to give us a talk at some stage on these sorts of things as well, because this is what she would cover in her first aid lessons. So they've given us an acronym called BFAST. And balance, so there's a loss of balance, headache or dizziness. The eyes become blurred, so your vision is blurred. The face, one side of the face becomes all droopy. Arms or leg weakness, they complain about weakness on one side of the body. Speech, they suddenly start talking with difficulty there, so they start to slur their speech. And you know that there's quite often a problem developing over there. Quite often they actually are struck mute and can't talk at all for a while. And if you see any of these signs, it is time to call an ambulance immediately. So symptoms of a stroke begin suddenly and may include one-sided weakness. Just going to move my pictures over the side over there. Or numbness of the leg, arm, or face. Vision problems in one or both eyes. Difficulty speaking or understanding speech. Excuse me for 1 second. Confusion. So they suddenly are not too sure where they are or what's happening. Dizziness, a loss of balance or difficulty walking. A severe headache. And the treatment for stroke will depend on the type of stroke. A person who experiences ischemic stroke may receive medications to help break up the blood clot and restore blood flow to their brain. Vitamin E is actually a very, very good thing to have in this case. And I've heard it said somewhere along the line that if you can take vitamin E within, I think it's 3 hours of a stroke, your chance of a 90+% improvement is very, very good. A person who experiences a hemorrhagic stroke may require surgery to fix the blood vessel that is bleeding out. So remember, a hemorrhagic stroke is one where there's a burst blood vessel. The ischemic one is more of a blockage with a clot. There is a difference over there. So again, referring to plumbing, think of a burst water pipe as opposed to a blocked toilet. Both of them are messy, different issues though. Follow-up treatments for stroke may include antiplatelet or anticoagulant medications to help prevent the formation of new blood clots, medications to lower blood pressure, medications called statins to reduce levels of cholesterol in the blood. And on that side note, in my opinion, statins are not always or should not always be the first option. If your doctor has recommended statins, please ask them for alternatives. Physical therapy or physiotherapy as we know it is, again, my opinion, a vital treatment in the treatment of stroke, because the sooner that you can get the affected body parts moving, the better the result. And I have seen some amazing results through consistent, persistent physiotherapy after a stroke. Rehab therapy, which includes not only physiotherapy, but also occupational therapy and speech therapy. And there we go with the speech therapy. Now, heart failure. Some of the signs and symptoms of heart failure include shortness of breath, tired, swollen ankles, loss of appetite, coughing, dizziness, abdominal bloating, or sleep disturbance. And I know in dogs, if you have an elderly dog that tends to cough a lot, I have been told that that is a sign of heart failure in dogs as well. So heart failure occurs when the heart is unable to pump enough blood to satisfy the body's needs. So basically what will happen there is all of our vital organs fit between your waist and your brain. So your body will focus on getting the best circulation to those areas. So when heart failure kicks in, you'll find that there is less blood going to your limbs, your arms, and your legs. Some symptoms of heart failure include, as per this picture, persistent coughing or wheezing. Now that could also be a sign of asthma, so please get it checked out. Shortness of breath, exercise intolerance. So basically, if you go to your doctor, they're going to do a stress test, and that will include things like maybe a stationary bicycle or a treadmill, and you have to do a certain amount of exercise on there. So they want to see how far you can go before your body becomes stressed. So they'll hook you up to all sorts of little monitors and things when they do that. There'll be an increased heart rate, a feeling of nausea, lack of appetite, swelling, not only in the ankles, but quite often in the hands as well, and a fatigue, not just COVID fatigue, but general fatigue, and confusion. So when you look at all of these things, you can see that these signs or symptoms cover a few different things. If you are having any of these symptoms, please get to see a doctor as soon as possible. Let them hook you up to monitors so that they can check and see exactly what is happening. Don't take these symptoms lightly. Arrhythmia is essentially, it's a short circuit of the heart. So there's various different fancy names for this. And there are some people in my family who suffer from arrhythmia, and they have to have this controlled through medication. There are some things that nutrition alone will not sort out, unfortunately. An arrhythmia is an abnormal heart rhythm. It may present with a heartbeat that is too quick, too slow, or has a distinctive pattern, meaning that it's very quick and then slow and very quick and slow, or it beats normally and then it stops. And then it beats normally and then stops. So there's numerous different things that happen that will all fall under an arrhythmia. Symptoms for this may include a fast or slow heartbeat, skipping beats, lightheadedness again, dizziness, fainting. You walk along and suddenly the person falls over for no known reason. Check their heart, see what's happening over there. Chest pain, shortness of breath, sweating, usually a lot of sweating when it's not 35 degrees like it was today. So those are some various different signs and symptoms, which, if in doubt, need to get checked, please. So how can we support our cardiovascular system? According to the World Health Organization, we can do the following. Number one, eat a heart-healthy diet. As I've always said, simple, not easy to do. If you're overweight, lose weight. Much easier said than done. You need to increase your regular physical activity to at least 2.5 hours per week. Now you think of your week. I'm not a mathematician, so you can do the maths. You got 7 days. Divide 2.5 hours between 7 days. I'm sure you can find 15 to 30 minutes somewhere along the line that you can take a brisk walk around your garden. If you don't have a garden, get a treadmill, go for a walk on that. Go down to the local shopping center and park on the very far side of it and walk. I've actually got a couple of patients who, because of where they live, it's not very safe. They tend to go down to one of our local malls and then walk rapidly from one side of the mall to the other. That is their exercise, which I think is a pretty good idea. Don't use tobacco. And when we say this, it's not just smoking. It also includes things like chewing tobacco, snuff, etc. Avoid the use of alcohol. And have your blood pressure and blood sugar checked regularly. I don't know about your area, but I know our local Lions clubs regularly have little, I wouldn't say clinics, but stands at the local shopping centers where they will check your blood pressure, check your blood sugar, check your various other little signs and things, all for free, just to be able to see, picking up, are you pre-diabetic maybe? Is your blood pressure elevated? Do you need to be referred to a doctor? Because a lot of these signs are silent. We take them for granted because it could mean a lot of other things as well. So they do these checks and tests so that they know to refer you to your local doctor. All simple to do, but also easy not to do. So how can Neolife help us? Neolife has a complete heart-healthy package suggestion of products to assist us. Obviously, a healthy diet is key, but we probably don't always get enough of what we need. Neolife can't help us with exercise, unfortunately, but they do help us feel energized enough to do basic exercises. So I'm not going to get into the nutrition side of things tonight. I would like to stop this presentation right here because I've only got about 10 minutes left. And I'd like to focus more on our heart health program next week. I'm going to stop sharing for now. And if anybody wants to make any comments or ask questions, you're welcome to do it. We've got about 10 minutes. But when it comes to things like exercise, there are a lot of simple things. You don't have to go down to the local gym. You can do a basic exercise program in your lounge or your bedroom or your front garden or wherever you'd like to do it. On the Neolife blog and in our quarterly Neolife magazines, they often put up a series of little basic exercises that one can easily do in the comfort of your own home. So you don't need to spend money on various different things. A couple of basic things I would suggest as exercise equipment: get some light weights. If you don't want to go out and buy weights, go to your kitchen and look around and see if there's maybe a bag of rice or a bag of sugar. Please, not white sugar. Even a water bottle. If you take a 1 liter water bottle, that is a 1 kilogram weight. If you just do some basic weight lifting with a water bottle in each hand, that is exercise. As I said, going for a brisk walk, 5 minutes. We're fortunate in that we live in a cul-de-sac road, so we can easily walk to the top of the road and back again rapidly when we need to. This is one of the reasons why I opted to do the park run, because not only was it part of the Neolife Challenge a few years ago, but it was also a way to force me to get out and do that exercise. And that is exactly where park run came from. It was a group of friends that were sitting together. They said, we're way too lazy, we need to do something. So they decided to join together and go for a walk. It wasn't a run, it was a walk. And they eventually opted on a 5-kilometer distance as being very, very doable. And I think most people over here are doing parkrun. It doesn't have to be a run. It can be a walk. If it takes you 2 hours, who cares? It is exercise. So any little thing to get yourself moving, to increase your heart rate, will work as an exercise. So do yourself a favor, get out there and get moving. It will only do you good. It cannot cause you any further harm. Does anybody have any questions so far?
I don't have questions. I just have one little comment about that exercise. 15 minutes of exercise daily reduces the possibility of a heart attack by 40%. Just 15 minutes, go for your walk to the top of the road for 15 minutes. Just increase your heart rate a little bit, and the chances of reducing your heart attack by 40%, that's quite a lot.
And it's a very simple thing to do. Thanks for that. Is that something that you mentioned in your first aid lessons as well?
Yeah.
Okay.
Yeah. And also with the stroke, there's 3 ways of causing a stroke. Just write the word T, like in tea and coffee. A thrombosis is formed in the brain, a clot of cholesterol or blood. Then the other one is slip my mind now. The clot is formed somewhere else in the body. Oh my God, starts with an E.
Embolism.
Formed somewhere else. Embolus, thank you. Is formed somewhere else in the body. It's normally that cholesterol in the heart that travels up. And the other one is your aneurysm, which is your burst blood vessel. That obviously by surgery only or never can you come out from an aneurysm. The other 2 are treatable, but an aneurysm not really.
And those embolisms can be caused by numerous different factors. And that's one of the things that keeps me busy at work is I fit what's known as anti-embolic stockings, which are compression stockings that we use after surgery. So whether it's big orthopedic surgery, so having a joint replacement done, whether it's things like having a Caesar or a hysterectomy or even an appendectomy, those are all cases where I fit anti-embolic stockings. People who are on ventilators and spending extended periods of time lying still in a hospital bed also get stockings, because those are known risk factors for that embolism to break off and go walkabout through the body and lodge in the brain, the heart, or the lung to cause problems. The stockings are just one of the preventative things that they do. They also usually administer blood thinners and that sort of thing as well. And they encourage people to get up and out of bed as soon as possible, because the sooner you can get a person up and moving, the better it is.
One of the other risk factors of both stroke and heart is the contraceptive pill. That is a huge factor of causing heart, stroke, and cancer, is that contraceptive pill. So at first aid, I tell the ladies and the gentlemen to use a Disprin between the knees, and that helps. You don't need the contraceptive pill then.
I'll stop recording before you go into that one. All right, I'm going to stop recording now.